welcome to the ViVE at ViVE. I'm Orundhati Parmar with MedCity News, and today I have Michelle Snyder with McKesson Ventures. So Michelle, let's talk about this conference.
Yeah.
What has been your impression of this so far?
I was thinking about that. I had a couple words. I think fun, I think energetic, and I think rejuvenating. So as you can tell, I'm in my kind of Miami, gear here. And I think on two levels. One, it's just been exciting to be back with people in person, right?
So
and I think there's a lot of energy and people feeling like we're getting back to normal a bit. On the other side, I think there's this excitement about getting back to a new normal in digital health, and with some of the changes that have happened during COVID and kind of forcing organizations to adopt technologies that might have taken 10 years to adopt. I think we're now starting at a different playing field, and I feel the energy, and it feels like there's a lot more excitement about partnerships and collaboration between many of the big established players and the startups.
You mentioned the pandemic. How did that shift, if at all, your strategic priorities?
Good question. So not that we were clairvoyant or anything, but I would say, it really, rather than shift, really caused us to kind of double down in some of the areas that we were really excited about. So kind of pre-pandemic, we were interested in hybrid care, right? And kind of integrating virtual care and in-person care. I think in other areas, chronic condition management, and I think, just as we've seen in the pandemic, that's become even more important, and the remote aspect of it in particular, right? I'm thinking about what technologies can enable that. I think another area where we were invested before COVID, but we continue to be super excited about, is in the biopharma area. And so we were in a clinical, decentralized clinical trial company, and I think that was one of the big things, besides telehealth, that we saw that was impacted so much during COVID, right? The ability to get patients into trials and to collect data, and especially have a diverse patient pool. So I think those were all areas that we're continuing to double down on. Pharmacy is another area, kind of more focus on the patient, putting the consumer at the center, integrating pharmacy with lab, right? And having that kind of be one seamless experience. I would say there's a couple areas that we were talking about, but we're really excited to focus on more care at home. And I did a recent investment in that area, and also probably digital therapeutics.
So let's talk about those notable investments you made in 2021.
Great. So yeah, two of my more recent investments, different types of companies. One is kind of a cancer precision prevention platform. There's been a lot of focus in the industry about precision medicine.
That's right.
And this is really about precision prevention.
Right.
Great entrepreneur in the Chicago area. And it's a platform that basically, I think about it as standardizing and democratizing cancer screening. So allowing people beyond oncologists, women's health, PCPs, to have a platform which lets them assess cancer risk for patients, then figure out the next best action. It handles some of the administrative tasks, and then streamlines the data back. And so my hope with this platform is that we can actually prevent some people from getting cancer, and in the cases where we can't prevent it, at least move it up so it's identified earlier, and people can get earlier treatment.
This sounds like Cancer IQ. Was it
It
Cancer
is
IQ?
Cancer IQ,
Okay, great,
yes.
great. And what was another one that you can mention?
The next company was Reimagine Care, and that is a Nashville-based company, and it's digital oncology care at home, really built for the value-based world, right? So thinking about how can we make the cancer journey for the patient better, and think about what are the things we could do in the home versus having them, and I don't know if you've ever had anybody with cancer. I recently went through that with one of my relatives, but the amount of time going to the hospital, coming home, waiting around, right? I think there's some of those tasks that can be done at home. And Reimagine Care is a platform that they work with payers and providers, kind of coordinate that care, figure out what can be done at home, monitor patients at home, bring in the oncologists or experts when necessary, and also bring in nurses when somebody does need to be in the home.
Actually, my older brother died of cancer 5 years ago, so this tool would probably have been a lifesaver in some situations at least. That's the ViVE at ViVE, and thank you so much, Michelle, for spending some time with us.
Thank you.